thank you for welcoming us to this important congress. Jolanda, Maas and I will address you on the topic of nature and mental health for nature, and we'll zoom in towards examples from the Netherlands. And we have a co-presentation, and Jolanda is so kind to operate the slides. Jolanda Maas is Associate Professor of the Vrije Universiteit in Amsterdam, specialized in the interrelationship between health and nature. She is one of the leading scientists in that field, and Jolanda is part of the Department of Clinical Psychology. I am the Director Executive of the Foundation Nature for Health, and both Jolanda and I are closely involved in green mental health issues, in particular in the Netherlands, and we're going to share our views with you. First, if we look at the global level, it's referred to that we're in a global mental health crisis. Globally, more and more people cope with mental health issues, and I give you just not two random examples, but two countries, including our own country, the Netherlands. But I read in the still back, please. One back, yeah. I read in the news that the other week that around 40% of people in Spain cope with mental health challenges, and yeah, also in the Netherlands, about 43% of all Dutch people experience mental health problems, issues at some points in their life. And about half of the youth, the issue is rather pressing in the Netherlands, cope with high levels of stress, and many cope with loneliness. So next slide, please. So the biodiversity and climate crisis and the mental health crisis are, in the view of Jolanda and me, but you see that also in literature, closely interrelated. Decreased nature and biodiversity correlates at some point of view with decreased mental health. And one of the factors there, not the only factor, is urbanization, which often results in less access to green spaces of people. Urbanization is also associated with increased level of illnesses, mental health illnesses. And that's in particular relevant because since a number of years, globally, for the first time in human history, more than 50% of people live in urban areas, and expected to rise towards more than 70%, or around 70%. And just some statements from literature, city dwellers have about 20% higher risk of anxiety disorders, 40% higher risk of mood disorders, and people born and raised in cities are twice as likely to develop schizophrenia. Next slide, please. Neighborhoods with limited access to green and blue spaces, they have more people with mental health issues, and also they experience, in general, more heat in summers. And more heat in summers is becoming more obvious also from the literature, and experiences creates more heat stress. Then we have, of course, the impacts from climate change, like storms and floodings and other effects, results in more people with post-traumatic stress syndrome. And also you can see more and more that increased worries about the global biodiversity and climate crisis results, and it's being referred to as climate stress. So next slide, please. So basically we have been thinking more and more also in the Netherlands, and I will show you some of our practical initiatives also later on, that one of the solutions is to turning vulnerabilities into strength, the vulnerability of mental health and the vulnerability of biodiversity, and cope with this crisis in a joint effort, and by, for instance, increasing connectedness to nature of people, increase involvement of people in healing nature, which also gives a certain purpose to life. We come back to that. Decrease screen time and increase screen time. it's important to understand that we're part of the ecosystem and that we're not on top of it. We're just interrelated, we're connected. And yeah, one of our initiatives is dealing with mental health care institutions. And there we'll talk about it further, but involve mental health patients and healthcare professionals in screening activities. It's very inspiring. And involve nature in mental health treatments. So basically, this is our statement, our philosophy, and now Jolanda will continue by also giving the science behind this. And then I come back later with some Dutch initiatives.
Yeah, so basically we started an initiative, and Rob will tell a bit more about that a bit later. But what we want to do is, yeah, in the Netherlands, therapists are basically performing their therapies inside in such an environment as you see right now. And what we want to do, we want to stimulate therapists to more often also use the outdoor environment in their cognitive behavioral therapies and other psychotherapies that they perform. And yeah, why now? Why should therapists use nature? And I want to give you a bit of information or background into that. If we go back, I started investigating the relation between green space and health in 2005. And back then there was actually hardly any scientific evidence, not broadly about the relation between nature and health, but if you look at the evidence for the amount of green space in the living environment and health. And that's why we started then with some studies. So for instance, in 2006, we published a paper, and this paper showed that people actually feel healthier if they have more green space in their living environment. So in the table, you see the percentage of green space below and the percentage of unhealthy people on the side. So people feel healthier. And we were also able, and this was published in 2009, to investigate the prevalence of diseases. So is it true that people who are exposed to green space more have more green space in their living environment, that they actually are healthier? And that was the case. So we saw that the prevalence of certain diseases, yeah, that those diseases were less prevalent in environments with more green space. So for instance, less people visited a general practitioner with complaints like depression, asthma, diabetes. And what's interesting is that, and I think probably most of you who are listening might be aware of this, but if you look at citations of these articles, you can clearly show or see that the evidence has risen enormously in the past few years. And this has led to a number of reviews, because I presented 2 studies which basically showed that people feel healthier, are healthier if they are exposed to green space more often. But what you want is to summarize all the evidence that's available. And there are now numerous of reviews available which indeed show that people who are exposed to green space more feel healthier, have better mental health, and less often have complaints like depression and anxiety. So if we compare this with 20 years ago, we could not have convinced therapists because that information was not there yet, and it is there now. So if we present this kind of information to the therapists, they might be more inclined to use nature in their therapies. And what makes nature such an interesting instrument to put into place in therapy, but in general for mental health, is that it can, that with this one measure, you can influence health in different ways. So it has an effect on your, it has a psychological effect. So less stress, more positive emotions, less negative emotions. And it also decreases attention fatigue, or you can recover from attention fatigue. It also positively influences lifestyle. So we see that people in nature areas are often more physically active. Connection to nature can have a benefit for social contacts. People feel less lonely if they are more engaged and connected to nature. People sleep better if they work in nature, for instance. So those are, that's with this one measure, you can influence a lot of lifestyle factors. And also what we see is that if you are walking or exposed to nature, that can also enhance your immune functioning because of the micro and macroorganisms that are present in natural environments, which are really helpful for our own microbiome. So those are really interesting mechanisms, and also there's less environmental nuisance, so less heat stress, for instance, in a natural environment. And what's also interesting is that the effects of nature, and especially psychological effects, seem to be larger for people who have more mental health problems. So that makes it really interesting to use nature more in mental health care centers. But then what would be interesting, okay, how can we convince those therapists? What are the mechanisms? Therapists always want to see the scientific evidence. They basically want to see randomized controlled trials where CBT is given in a natural environment and then in an indoor environment, and they want to know how that works, and then they will actually do it. At least most therapists or psychologists in the Netherlands work that way. But as those RCTs are not there that much, we try to convince the therapist by giving them information and showing them, okay, but if people are exposed to nature, they have more positive emotions, less negative emotions, they recover from stress. And it also has an effect on cognitive flexibility and working memory. And those two aspects, so cognitive flexibility and working memory, are often important elements of cognitive behavioral therapy. So that makes it worth to try to use it in a natural environment. We performed a more qualitative study to get some insight into the value of nature during psychotherapy. I cannot go through the whole model, but what's interesting in that, I think, is that what we saw is that if you perform therapy in nature, people can say that they come closer to their own emotions, and that they feel that they are more able to be themselves. And because in therapy you want people to open up, it's really important that those aspects are stimulated by this natural environment, because nature soothes, because it relieves, and it does not judge. And that gives you a feeling, or at least that's what the patients said, that gives them the feeling that they are more able to be themselves. Really important, but a lot of therapists don't see this kind of information. So Op and I are really trying to get this kind of information to the therapists. Other mechanisms which could be important to tell to the therapists are that people are more physically active often in these natural environments. So if you perform therapy outside or walking, I hear some background noise. I'm not sure. Okay, hope you still can understand me or hear me. So people are more, if they are outside, are more physically active. You can reconnect with body and mind in a natural environment, and it also creates relationships. So what we can see that if you walk beside your patient, if you're a therapist, you get a whole different relation with your patient than if you sit opposite each other. So that's interesting, and that's something that therapists, at least in our department, do not learn, for instance. So it's something that they need to be taught. And what we also see, and that's also really interesting, is that it's not only important for the patient's mental health, but also for the one who's providing the therapy. So also therapists' well-being is really important, because we have a future where we have less therapists and more people have mental health problems. So we want the therapist as well to be vital and healthy. We tried to get some more insight in these mechanisms. We set up a solution-focused brief therapy session of 45 minutes, and we performed a 3-armed randomized controlled trials in 3 different environments. So they could have this session in the forest, Amsterdam's forest, or in an urban setting, or in an indoor setting. And we did this among healthy students, so not yet in the really in the mental health, the people with mental health problems. But the session was set up in a way that it's combining walk and talk therapy with student well-being. And the first results show that this session, which we set up, positively influences outcomes. So we saw that, for instance, students afterwards procrastinate less, their self-efficacy improved, the depressive symptoms went down. But we didn't find any differences between the three conditions. On the other hand, we did find that in the session they had to set a goal, and goal attainment was higher in the nature session than setting than in the other settings. And we could also see that stress, both before the session and after the session, was lower in the nature session. And also they perceived the session as more restorative, more enjoyable. So they gave it a grade between 0 and 10. And in nature, they really enjoyed the session more. And they had a higher intention to follow the session again, which is really interesting, of course, in therapy, where you often have more sessions than one. So basically, taking all this together, it's really interesting, and of course there's a lot more to present, but we only have 20 minutes. But this makes it really interesting to bring nature to the healthcare centers, and that's what we're trying to do in the Netherlands. And Rob is going to give a bit of examples of what is happening and what we're doing right now.
Thank you, Jolanda. Indeed, now some experience from the practice of healthcare. 2 years ago, in fact, Renske Visser of IVN Nature Education, Jolanda, Maas, and I decided to explore an initiative called Groene GGZ, Greening Mental Health Care in the Netherlands. We thought that would be tough to do that with mental health care centers, because there is quite a strain on these centers. We talked about the crises. It's really evident also in the centers. Nevertheless, when we explored it, we were confronted with a lot of enthusiasm in healthcare centers. Next slide, please. And basically now we are in fact developing and implementing an initiative with 18 so-called front runners of green mental health care institutions all over the Netherlands. Here you see a map of the distribution, which includes the biggest mental health care centers, but also a few smaller ones. And altogether they have more than 40,000 employees, over 300,000 clients, and the land they comprise constitutes about 1.5 to 2 national parks equivalent in the Netherlands. So basically there is a lot of enthusiasm and a lot of positive energy in this initiative. And I will give you some examples there. But before I do, I will just address briefly the 5 pillars of the Green Mental Health Care Initiative. In the Netherlands, we try to accomplish together with the Green Mental Health sector, or the mental health sector. We try to promote increase biodiversity with at least 5% on their premises in the coming years. As Jolanda also addressed the nature involvement in treatments, we like to increase that with 5 to 10%. That in fact treatments outdoors related to nature are being implemented more. We also want to increase the health and vital employees. If you look at the health situation of employees or health professionals in institutions, they're rather under stress. So also quite a substantial amount with burnouts. So then also one element is the integration, the social green integration with neighborhoods. Sometimes there is tension between this institution and the neighborhood. We try to develop a social space where also the mental health care areas are open, accessible for the neighborhood, and there are joint activities. And a very important aspect is as well inspiration, scientific and practical experience. we address. I give you now quickly some examples of some cases, and activities involved like inspiration seminars. We also try to find activities that really motivate people, staff and clients in institutions. To the right you see a picture of a visual of the results of one of the sessions, and in all the sessions we have, there is a lot of enthusiasm. We also try to lobby and fundraise because we also need to have the government and the insurance companies on our side, and sometimes there are stumbling blocks we have to deal with. So part of the project goes in the hard world of insurance companies. And one of the things we launched the end of last year was the green perspective of the Groene GGZ, offering nature to people on a mental treatment waiting list. And in the Netherlands, there are more than 80,000 people waiting sometimes for over 8 months, and you're not getting better from waiting. You're too much in your head. So we offer nature services so people can be also active with their hands and perhaps at least not get worse in the meantime. So next slide, please. Some examples of mental health care initiatives. For instance, GGZ Lentes in the north, Zuid-Laren, had a green mental health care month, involving staff, involving clients, involving family members, involving neighborhood. And they started greening their premises. They started doing social community gardening activities. It really resulted in something, a community feeling, and a greener premises, which also is good for treatments. Next slide, please. One of my favorites, a smaller institution, GGZ Utica de Vijsprong, is a combination of a mental health care institution and a biodynamic farm. So clients from the mental health care institution also help in the farm with activities that inspire them, and they both work on regional products which is sold in a shop in the institution. And also one of the policies is very practical. When people have meetings in this institution, they prefer to go outside, as you see the picture on the right, instead of being under neon light. So next slide, please. One example is from GGZ Eindhoven in the south of the Netherlands. They start promoting the healing environment. They're in an estate, and they decided to green it, to restore the brook on the premises, to develop nature all over the place, and also green the buildings. And one initiative is there that they introduced the brain path. That's a path of 3 to 4 kilometers where the healing environment of this institution can be experienced by clients, by psychologists, psychiatrists treating patients, but also by the neighborhood around it. So this is very open premises. Next, please. And a final example is from Zeeuwse Gronden, Terneuzen, near to the sea in the southwest of the Netherlands, where they in fact started to integrate in treatments and support nature and animals as vital ingredients in treatments. And when you come there for the first time, you have the feeling like not a clinical institution, but you have a feeling you're in a place where you can breathe. So it works quite well in practice also, the theory, the scientific evidence that Jolanda presented. So this we try to roll out, and we're very enthusiastic about it. We hope it can perhaps work in other countries as well. And Jolanda will now finalize the presentation by, what did we learn from the green mental health experience so far?
Yes, thank you, Rob, for the interesting inputs. What did we learn so far? So I think we've been working 2 to 3 years on this project just to set it all up and so on. And what we feel is that there's really a lot of energy in the initiative. So the mental health care institutes are really cooperating very well, and it's strong, and there's a positive energy. And what we see is that green mental health bridges different worlds. So we talk to these green mental health institutes, but at the same time talk to them about biodiversity conservation. Science is involved, so we're trying to set up a large a research agenda on this topic. It also involves health insurances, businesses. So it's a really large project with a lot of different stakeholders, which makes it really interesting. And nature really has the potential to contribute to healing people with mental health challenges. And what's interesting about this project is that we also try to look at it the other way around. So we want to also boost biodiversity in institutions. What we see if we look at research, that we want to set up research, but what we see that the first steps in research should be is that we have to focus on implementation. So although these healthcare facilities are mental health care facilities are really keen on working on this topic, they find that, at the same time it's hard to get the psychologists who work with the patients to go outside. They feel like they need more best practices, they need more tips and inspiration, and also more scientific evidence to really enhance and make sure that people really go outside. So that's the thing that we will discuss in the coming, or work on in the next session. But in itself, it has been a really interesting project, and that's where we wanted to end this presentation. So thank you very much also on behalf of Rob for listening. If you are interested and you would like to know more about, for instance, a scientific background, or about the initiatives, about how we set up this this initiative, feel free to contact us, and we would also be very interested in working together with other countries and hearing more about the things that happen there. So thank you very much.